Every month, millions of Kenyans part with their hard-earned money, believing it will protect them in times of sickness, pain, and emergency. It's a promise of care, a lifeline, a right. But behind the promise lies a lie.
The scandal has been brewing in the health sector, orchestrated by unscrupulous business people only in need of profits, but posing as caring medical service providers.
A system built to save lives, bleeding from
20
within.
individuals will be charged alongside Web Tribe Limited for the loss of 1.5 billion shillings at the National Health Insurance Fund.
This is the story of how billions disappeared, not by mistake, but by design.
This chain of organized private facilities has been seen public money is meant for stealing.
Where fake patients were treated in real hospitals and a humble receptionist became a millionaire overnight.
The 39-year-old multi-millionaire amassed so much money in a span of 4 years that his spending betrayed him.
This is not fiction. This is the NHIF heist. A new policy, a small department, a simple mission to offer health coverage to Kenya's formerly employed. But no one could have guessed that this humble fund, the National Hospital Insurance Fund, or NHIF, would go on to shape the very future of healthcare in Kenya. At first, it only covered salaried workers earning more than 1,000 Kenyan shillings a month.
Those who are going to pay, starting from September salaries, we will be in a position to give them outpatient and inpatient services.
A limited safety net in a country with growing health needs. But then came the turning point. In 1972, the walls began to crack open. National Health Insurance Fund extended its hand to the informal sector, to the street vendors, the farmers, the self-employed, people who had never known insurance before. It was more than policy, it was hope. By 1998, NHIF had outgrown its old skin. It became a state corporation, complete with a board of management, a new era of leadership and accountability. But Kenya's health challenges weren't slowing down, so NHIF had to evolve again. Between 2007 and 2009, it did just that. With initiatives like Zalendo Cover, NHIF reached deeper into communities, bringing outpatient services to families that once felt invisible. The message was clear: healthcare should be for everyone. But even giants have their limits. Over time, cracks began to show. The National Health Insurance Fund, NHIF, collects tens of billions of shillings every year, with its average annual revenue hovering around 60 billion Kenyan shillings. But with all that money flowing in, corruption hasn't been far behind. Over the years, NHIF has become a hotspot for financial scandals and internal theft, including cases like Frederick Sagwe Onyancha, a former NHIF employee whose lavish lifestyle.
NHIF receptionist Frederick Sagwe and 2 others were today charged with 1 count.
The 39-year-old multi-millionaire amassed so much money in a span of 4 years that his spending betrayed him.
It started with a smile, a receptionist at Kenya's National Hospital Insurance Fund. Polite, modest, the kind of guy you wouldn't look at twice. But behind that soft-spoken demeanor was a man whose fortunes were rising fast. In 2007, Sagwe joined NHIF, earning just 50,000 Kenyan shillings a month. By 2013, he was appointed to the Tender Evaluation Committee. And that's when everything changed. His income on paper? 150,000 Kenyan shillings, but his lifestyle, pure billionaire energy.
According to investigators, Sagwe bought 8 houses at Green Park Estate in Athi River,
each worth 20 million Kenyan shillings. That's 160 million Kenyan shillings spent while working in public service.
That money is more than the amount it cost to build Makueni Mother and Child Hospital, fully equipped at 135 million, meaning there would still be enough change left for him.
And all that we know of him is that he is a receptionist at NHIF, earning 150,000. No other known source of income.
And it didn't stop there. He drove a fleet of luxury cars, Range Rovers and Toyota V8s. He renovated his home to a stunning 40 million Kenyan shillings value, complete with designer interiors. So opulent, it was featured on TV.
Facts being right, it's extremely incriminating, because you would have to have hit a jackpot that you can't hide if you're able to buy 160 million worth of property in one single year.
25 million wedding at Safari Park, enrolled his kids in international schools, and opened a 50 million Kenyan shilling car and carpet cleaning business chain across Nairobi. All this while working at an institution meant to help everyday Kenyans access healthcare.
A major scandal has been brewing in the health sector, orchestrated by unscrupulous business people only in need of profits but posing as caring medical service providers. Through innocent patients in need of genuine care, they saw an avenue for money minting, and through a government health insurer intended to sort out medical bills for the poor,
a silent heist was unfolding. Not once, not twice, but systematically, year after year. National Hospital Insurance Fund employees and hospital administrators joined forces in one of the boldest public healthcare scams in Kenyan history. Here's how it worked. Hospitals across the country filed claims for treatments that never happened, fake surgeries, non-existent chemotherapy, and even ghost patients. Some facilities submitted claims for more cesarean sections than even Kenyatta National Hospital.
Carry out unnecessary procedures on the patients and later used the various procedures as avenues of fleecing patients off their NHIF benefits.
Think about that. They billed the fund for lives they never saved. A CT scan, billed at millions more than it should have been. Routine procedures, priced like high-end surgeries. NHIF officials didn't just look away, they approved the payments. Over 94 million for CT scans, over 285 million for inflated surgeries, all rubber-stamped, all paid. Even within NHIF's own offices, the looting didn't stop. Suspended employees were still on full salary. 15 workers were overpaid housing allowances. 536,800 disappeared quietly through salaries. Some contracts worth 306 million shillings were executed before they were even signed. That's not a mistake. That's a system built to steal. In another scheme, NHIF double-charged the government, particularly under civil servant medical covers. Hospitals claimed both capitation and fee-for-service for the same patient. That means the same treatment was paid for twice or never delivered at all. Billions were siphoned this way. Take this. Out of 9 billion shillings collected under the Work Injury Benefits Act, only 200 million shillings went to actual victims. Where did the rest go? Lavish homes, luxury weddings, cars with engines bigger than the operating budgets of some clinics.
Sagwe was named as one of 20 suspects listed by the Director of Public Prosecutions, Udin Haji, for corruption at the NHIF.
I don't know even how to handle this money because they come so careless. Like this guy, he said, you buy 8 houses, same location, Obviously people will...
Young man is just a drop in the ocean. There are many people who have been living like this. Many people.
Go to Karen. See who lives in Karen. Most of those people are public officers. Some of them very young, holding very junior posts. I mean, it's there. It's obvious.
Continues vulnerable people in the country who depend on the NHIF to get quality and free medical services in county hospitals continue to suffer.
CEO Geoffrey Mwangi and his finance director Wilbert Kurgat have since been taken to court over the withholding of documents related to the transactions and have been freed on bond.
The NHIF was built to protect the health of ordinary Kenyans. But for years, it became a feeding trough for the powerful, the connected, and the corrupt. What should have saved lives? Lined pockets. From luxury homes to fake claims, from ghost hospitals to inflated tenders. This was not just theft, it was theft with consequences. Real people suffered, real healthcare collapsed. While the culprits walk free, released on bond, Kenyans are left with empty promises, stalled court cases, and a broken system.
That the Ministry of Health will work to transform NHIF to meet its intended mandate. Just like KEMSA, we will do everything possible to achieve a sense of professionalism, patriotism, and proactivity. As we embark on delivering services to citizens, there will be casualties, but it will be for the sake of a better healthcare system and a healthier nation.